Good afternoon, everyone. My name is Andres Hurtado, and today's presentation is about the healthcare system around the world. Please refrain to the end of the presentation for any questions or concerns. Healthcare system around the world, Colombia, South America. How they access healthcare? How do they pay for the care? There are two types of healthcare systems in Colombia established by Law 100 and consisting of two parallel plans. Contributory health plan for those citizens who are able to pay and a subsidized health plan for those who are unable to pay. The population is divided and conducted by a survey in order to decide in 6 sections from the poorest, 1 to 2, to the richest, 3 to 6. With this in place, the ones in the contributory plan will contribute a certain amount from their salaries to maintain the system. On the other hand, the state will cover the costs corresponding to those in the subsidized plan, sections 1 to 2. Quality and services in Colombia. What is the quality of the healthcare they received? Are there any unique services provided? The pros and cons of the system. The quality of the healthcare system in Colombia depends greatly if you have the money to cover for your own expenses, or depend from the state to decide what will cover. In the contributory plan, covers all illnesses and health problems, while the subsidized plan leaves out many services towards illnesses, leaving the majority of the populations in poor conditions or out of luck. A unique service that both plans work on is that they use third-party entities to manage the budget, and it goes by demand. Instead of having a set budget, they will go by the number of the invoices to be paid. The pros of the system is that available for everyone, and the reason that many are missing the plan offered by the states, it's due to the lack of surveys to account for those families in need of healthcare. Also, it has been kept the life expectancy after birth from males to 72.08 years and females 78.61 years. The cons of the system is that it depends greatly on how much you can afford in order to receive the best care. Similarities between Colombia and the U.S. healthcare system. Population and demand of healthcare. The comparison on the international view in healthcare varies from every country. For example, in Colombia, they deal with the demand of equipment, supplies, and workforce to take care of its patients, and especially young girls between their 20s due to the high pregnancy number. In the United States, the growth of population is also increasing the demand of equipment and healthcare professionals. Differences between Colombia and the U.S. healthcare system. Diversity is not as common as in the United States, which we can use as an advantage to ease the problem and increasing the workforce in the field. In the budget situation in Colombia, it depends greatly on the contributions of the workforce to sustain the system and money charged by public hospitals for services rendered. Also, mismanagement is a huge cause of the flaw in the system. Unlike in the United States, there has been many ways to get the population notified and how to enroll for free through the Obamacare. On this slide, we have all the references used for our presentation. If there's any questions or concerns, please don't hesitate to ask. Thank you.